Good afternoon. My name is Renee. I'm currently a student with UMGC, and today I will be presenting a PowerPoint presentation for my Concepts of Biology class, a disease topic selection of our choice. I decided to pick this disease because there's still a lot of stigmas within the society about HIV/AIDS that people do not know about. Without further ado, we're going to move to our next slide. What is HIV/AIDS? HIV, or human immunodeficiency virus, is a virus that attacks the body's immune system. Its main purpose is to infect CD4 cells, also known as white blood cells. If not treated, it will lead to AIDS, which is acquired immunodeficiency syndrome. AIDS is the final stage of HIV. HIV has no cure, but it can be controlled through medication. It spreads through sexual contact, drug injection equipment, and mother to baby during pregnancy and at birth and breastfeeding. Origins and history. Scientists believe that it originated as far as the 1800s, that it possibly got transmitted from a similar virus found in monkeys, which is called the simian immunodeficiency virus, and that it got spread into humans through the handling of infected monkey meat. The first case was in the 20th century in West Central Africa. By 1960, it has spread around the world, and the first case in the United States was in California in 1981 in 5 young homosexual men. Signs and symptoms. Physical signs go from rashes, most of the time red, ulcers in the mouth, night sweats, and experiencing significant weight loss. Symptoms, they go from headaches, fatigue, fever, muscle aches, joint aches, sore throat, and chills. Next slide. Effects on a healthy body. So the way it works is that once the HIV is contracted, it will go into the system, and then it will infect, or it will attach, it will fuse into one of the white blood cells or CD4 cells, also helper T cells, and then it will release its genetic material, or how I like to call it, its eggs, inside the cell, therefore infecting it and also combining its genetic material with the DNA. Therefore, it will create more cells, more infected cells, and those cells will be sent to other healthy cells and it will infect them. Who gets affected the most? This virus affects certain ethnic groups, especially the bisexual and men who have sex with men. In 2020, almost 70% of all cases were among gay and bisexual. Also, transgender women who have sex with men. Some of the races that get affected the most, or ethnic groups that get affected the most, are African Americans and Hispanics, and also people who inject drugs. Risk factors and disease frequency. More than 1 million sexually transmitted infections happen every day. 374 million new cases of STIs each year around the world. 3 out of 4 of sexually transmitted disease are uncurable, according to the World Health Organization. In 2021, approximately 38.4 million in the world had HIV/AIDS. In the US, approximately 1.2 million people have HIV/AIDS. Methods for testing. There's 3 types of tests. There's the antibody test, which is a self-test, and it takes up to 23 to 90 days to detect the HIV after exposure. The second one is antibody, and it looks for HIV antibodies and antigens, and it takes up to 18 days to 45 days. And the third one is the NAT, NATS, and it actually looks for the virus inside the blood. And this one is the fastest, and it can take up to 10 days to 33 days after exposure. prevention. Do not share any type of needles or sharp objects. This includes razors, knives. If you do go get a tattoo, make sure you go to a tattoo certified artist. If you do have sex, make sure you protect yourself. HIV prevention medicine. This medicine is for people who already have acquired the virus and is for them, and it helps them to slow down the spread. Constantly test yourself for HIV and abstinence, aka not having sex. Conclusion: HIV is a virus that is transmitted through sexual intercourse, sharp objects, and from mother to baby. HIV affects the gay community the most. Even though there is medicine that controls it, it cannot be cured. AIDS is the last stage of the virus where the immune system has been severely damaged and it can no longer fight off the smallest infections. The best way to prevent this virus is by having abstinence. I think this is one of the reasons why the Lord, why God tells us to not have relationships before marriage. Why? Because He wants us to prevent us from acquiring any of these diseases that are uncurable. So again, thank you. Thank you for listening us out, and I hope you enjoy this presentation. God bless you.